I'm making this video for my patients who are thinking about having spine surgery. If you're a patient being treated by another surgeon, you need to have a very similar discussion with your surgeon about the exact same issues if you're considering spine surgery. So for my patients, this is what I tell them before they have surgery. The first thing that my patients need to understand is that the goal of surgery is to make you better. And having said that, no surgeon can guarantee that your symptoms are going to be 100% better. In fact, after recovering from spine surgery, some patients are 90% better, some are 70% better, some 100% better, and there's a whole host of variation. So the goal of surgery is to make you better, not necessarily completely eliminate your problems that you were having before surgery. That is a very important question of expectations that I address with my patients when I'm talking to them about having surgery. The second thing that you need to understand if you're having surgery is you will need general anesthesia. You will need to be put to sleep. Now, depending on how big the surgery is, what kind of surgery you're getting, this could be as little as an hour, hour and a half, or it could be 4, 5, 6, 7, 8 hours if it's a major fusion surgery. And one of the side effects of general anesthesia is that in rare cases it can have pretty significant negative adverse events. For example, in a small percentage of patients, anesthesia can lead to heart attacks, strokes, blood clots, organ failure. You could even die from these complications. Now, again, these possibilities are very rare, but if you're considering having spine surgery, you have to be aware of them. And for this reason, before having surgery, it's very important that you get medically cleared by your doctor. The third thing I tell my patients is that when we're doing surgery, we're working next to some very important and delicate anatomic structures. For example, when we're doing surgery in the neck, for example, like a cervical fusion, we're working next to major blood vessels like the carotid artery, the jugular vein, the vertebral artery. We're also working right next to the spinal cord, right next to the nerves. We have to move the esophagus, the trachea or the windpipe, and the voice box called the larynx a little bit off to one side to be able to do our work. In a very small percentage of cases, you can get bleeding, you can get spinal fluid leak, you can get an infection, you can get new neurological problems. In extraordinarily rare cases, you can even get paralyzed, or a part of your arm or your leg that was previously doing fine may now have numbness and tingling. Now, all of these rare possibilities can happen, but they are very rare. And before having surgery, you have to know about that. Similarly, when we're working on the lower back, the lumbar spine, if you're having a discectomy or laminectomy or fusion surgery, we're again working next to major blood vessels, arteries. You can get a spinal fluid leak, you can get bleeding, you can get a hematoma, which in rare cases can cause paralysis. And any of these problems can potentially require a second or more surgeries to fix. Now, again, this happens very rarely, but we do have to tell you about this. The fourth thing to understand is that recovery from a spine surgery is not a linear process. From time of surgery to the point where you're going to be as good as you're ever going to be probably takes somewhere between 6 to 12 months. But the majority of the improvement that you're going to get in that 12 months happens within the first 3 months after surgery. So the average patient, not all of them, but the average patient will have a significant improvement rapidly within the first 1, 2, 3 months, and then gradually they will kind of plateau and month by month have a little bit of an improvement, which can be ongoing until up to a year. So we're not going to be able to tell how much improvement you're going to get until we wait in the 6 to 12 month period. That is what we call the end of healing. So you have to be aware of how long it's going to take for you to recover from surgery. The fifth thing you need to understand is that when you're having a surgery, for example, like a discectomy, there's a possibility that that disc may herniate again, and you may need to have another surgery, maybe even a fusion. Also, if you have a fusion surgery, for example, if you're having a L4-5 laminectomy and fusion, there's a small chance that that fusion may not heal and the screws and the rods may become loose, and you may need to have that surgery redone. Also, the disc above or below may degenerate, and you may need to have surgery done at that location as well, some point down the road. So if you're having surgery, that doesn't mean that it's going to cure all of the problems for the rest of your life. It just means that we're trying to fix the problem as it exists right then, and moving into the future, we don't really know what's going to happen. If you understand all these issues and you have a good discussion with your surgeon, you can make a very educated and smart decision about whether surgery is good for you or whether you should not have surgery. And when I talk to my patients about having a surgery, I have the exact same conversation with them that I'm having right now, plus some added details, which is particular to their own condition. So I hope that if you're looking at a surgery with a surgeon, you have a similar discussion with them at that time. Finally, I have a very good video, and I'm going to put a link to it right over here, which is titled, Don't Have Spine Surgery If. If you're thinking about having spine surgery, I encourage you to watch it. And as always, thank you for watching. If you have any questions, please feel free to share in the comments below and hit the subscribe button. Thank you.